Joining me today is fertility specialist Dr. Sami David. A pioneer in reproductive medicine, Dr. David performed New York's first successful in vitro fertilization and has since revolutionized the approach to infertility by combining Eastern practices with traditional Western medicine. Today we'll discuss why he no longer performs IVF and what every woman needs to know about her reproductive health. Dr. David, welcome to Give and Take.
Thank you so much. Thank you.
So you've dedicated your career to improving reproductive health. What attracted you to this field in particular?
It was an exciting field. You know, I first went into internal medicine for a full year, so I have the expertise of being a good medical detective, using that 1 year of internship in medicine. I then went into obstetrics and gynecology, which was delivering babies and doing the routine OB. In 1976, the specialty of infertility became a subspecialty in obstetrics and gynecology. I found it fascinating because it was the marriage of internal medicine and obstetrics and gynecology. And actually, it's the marriage of several disciplines. You're a microsurgeon repairing blocked tubes and repairing the surgical problems with the patients who have trouble getting pregnant. You're an endocrinologist trying to decide what hormonal imbalances may be occurring in the woman who's having fertility troubles. You're also an immunologist trying to find out if there was anything going on where the patient is actually attacking the fetus or not able to get pregnant because of immunological issues. You're an infectious disease doctor when looking for bacteria in the man or in the woman. And it's a marriage of everything and the creation of life, which is absolutely fascinating.
Well, it also sounds like you're part detective because you basically have a puzzle when you have unexplained fertility and you've got to figure out what the cause is.
That's the beauty of this specialty. I really love being a medical detective. And not only that, you're a detective when it comes to the woman as well as the man. So you have a couple, it's even more challenging when you have a man and a woman and you have to be their detective. And I've learned over many years, 30 years I've been doing this, that you have to take a very, very complete prolonged history on both the husband and the wife.
Well, let's talk about that because you performed the first successful in vitro fertilization procedure in New York State, but now you're very critical of IVF. Why is that?
Well, it's not that I'm critical of the procedure itself. I'm critical that it's being used as the first line of treatment. And right now, the way I'm looking at, I have the chance of seeing how the field of infertility evolved over the past 30 years. And more of my younger colleagues entering the infertility field just believe that in vitro is the first line of treatment. Why bother to make a diagnosis? Why bother to do anything else? Just come on in, we'll make embryos in a petri dish. As long as the woman has a uterus, has ovaries, and the man has some sperm, we'll make a pregnancy. But that's not the way medicine really ought to approach the field. You ought to be a good medical detective. You need to know why people are not getting pregnant.
And why aren't people getting pregnant? What are the main causes of infertility?
Multiple causes, in fact. Some are just lifestyle changes. The woman who runs too much, for example, gets the endorphin rush, may not be able to hold a pregnancy because the hormones are off. A man who takes tub baths or jacuzzis. So many little minor things, simple common sense advice can lead to a healthy pregnancy without having to resort to in vitro or fertility drugs or even inseminations. You really have to delve into it in great detail.
So for the patients that you see now, what percentage would you say are you able to figure out the cause of the infertility without them having to rely on IVF?
How many times I could make the diagnosis is probably 85 or 90%. The thing is that diagnostic issue, the finding of that disorder, is it repairable with just natural intercourse, natural ways, or do they have to resort to in vitro? And that I can't give you an actual answer for. But yes, the doctor has to be a good medical detective.
So if basically your point is that so many couples today are now right away being sent to IVF rather than having the proper detective work done, do you think that IVF is a safe procedure?
In multiple cases, when you have to do many cycles, it may pose a serious problem. I mean, the jury is still out about whether all these fertility drugs may cause ovarian cancer, breast cancer, endometrial cancer. Also, the FDA is looking very critically at whether the babies conceived through in vitro are in fact as normal as their cohorts that are conceived naturally. There are some concerns, and therefore it should not be used as the first line of treatment.
In terms of the health of the babies, what are the main areas of concern?
Well, there's a higher risk of twin pregnancies, and therefore prematurity, and perhaps some cognitive problems with the premature babies as well. There are a few other diseases that are very rare and may increase a little bit, not very much, a little bit, in babies conceived with IVF. The point is, why do you need to pump the woman up with fertility drugs? Why do you need to go through this procedure when something as simple as some advice, lifestyle changes, or acupuncture, or herbal therapy can accomplish the same thing?
So let's talk about that. When a patient with unexplained infertility first comes to you, what is the first thing that you do?
Well, I don't believe in unexplained infertility, all right? So there are a couple of reasons.
There's always a cause.
Usually, about 98% there should be a cause, right? The things that are most commonly missed by my colleagues who do in vitro would be infections in the man, or maybe a mild infection in the woman. So one of the first things I do, besides the long history and understanding lifestyle changes, look for bacteria in the man, look for bacteria in the woman. If that's negative, another cause for unexplained infertility is sperm antibodies, where the man could be allergic to his own sperm, or the woman could be allergic to sperm. And this is all treatable. Another cause of unexplained infertility is endometriosis. Now that requires a surgical procedure to diagnose and treat it. This is where I have to try to make a judgmental decision whether or not the patient should go on to doing IVF, since I have not come up with a cause for their fertility, or they come in for laparoscopy and look for endometriosis and burn it away with a laser.